there are socioeconomic factors that are at war for our health. Socioeconomic factors that are at war for our health. One is access to quality resources. Access to quality resources, right? Access to preventative care. The ability to, well, let me back up and let me talk a little bit. So the studies, when they do the studies, it shows that a lot of places where they have higher incidence of things like blood pressure and cholesterol, right, and diabetes, are in areas where the socioeconomic environment is not the wealthy people. Let me say it that way, right? So where there is poverty, where people are not as educated, right? You go out and you find the park that is like the park in the city, right? The one where, they've got lights, they've got golden streets, they've got, trees galore, everybody's walking, they've got their little dogs and they're going, that's not in the poor neighborhood. That's not in the lower income neighborhood. Let me say that, using some right terms, right? That's usually in the more affluent neighborhood. And so if you want to walk and do all those things, you've got to go there. Well, if you don't have a car to go there, right? What does that mean? Yeah. And then preventative care, right? So there's a lot of data, there's a lot of teaching, there are a lot of classes, there are support groups. And where are those support groups typically? Right? Sometimes you don't have access to them, but there's nothing going on. There's not a class. You got to go somewhere else to find the class. And then this whole idea of the food desert. And the food desert is, let me give you a simple definition. This is a place where there's not access to fresh fruits and vegetables and the healthier things that we say that we want people to eat. So you go to some inner city areas and you can't find fresh fruits. You can't find fresh fruit, or they're limited. Let me say, maybe you can find them, but they're limited, not of good quality. And so this idea of coming in and putting in resources, stores, farmers markets, whatever it is, so that in those areas now there are those resources that people can get to, and those people can begin eating the way we tell them, because we're talking to them about eating a certain way. But if they don't have access to the materials, they don't have access to the food, the education on how to prepare those types of things, then it's not really of any benefit to them, right? So food deserts, and what's the repercussion on the health of someone who lives in the food desert, who doesn't have access to those resources, who's not able to transport themselves to those areas, right? Because they don't have an automobile, they don't have a car, they don't have anybody to take them over there. So once again, we're talking about the war for our health. So a lot of things can affect our health. So what do you think I'm going to say about this? How do we fix this? We've got to get involved. We've got to say to our local politicians and those who are in authority, those who are designing, those who are zoning, those who are granting permits. Hey, we need some over here. We need you guys to come over here and do some things here. Now let's extrapolate this to some countries where there is not, right? There's not fresh water, there's not food, right? That becomes a huge global problem. So socioeconomic factors that affect our health.